After performing hand hygiene and ensuring privacy, introduce yourself to the patient. Then identify her using 2 identifiers.
Tell me your first and last name.
Donna Wiedemann,
Date of birth.
9/6/53.
Okay, today I'm gonna be performing hand and foot care on you. Okay, and I need to step out and get a few supplies, okay, so we can get started.
Okay.
I'll be right back.
Then arrange all the equipment you'll need on the overbed table. Before performing nail and foot care, inspect the patient's fingers, toes, and feet, and evaluate her circulatory status. Put a waterproof pad on the floor beneath the patient's feet. Fill a wash basin half full of warm water and test the temperature.
I have the water for your feet, Donna.
Oh, good.
Place the basin on the floor. Assist the patient in immersing her feet.
How does that feel?
Excellent.
If the patient is unable to sit in a chair, place him in the supine position and elevate the head of the bed 45 degrees.
Be putting a pad up underneath your feet.
Then place a waterproof pad on the mattress and set the wash basin or basins on it. Support the patient's knees with pillows as needed.
Feet in the water. How's that foot? Is that
That's
comfortable
fine.
too? Okay. I'm gonna cover you up, and I'll be back.
Adjust the overbed table to the low position. Fill an emesis basin half full of warm water and place it on a towel on the overbed table. Guide the patient's fingers into the basin and rest her arms in a comfortable position. Again, be sure the water isn't too hot. Unless she has diabetes, peripheral neuropathy, or PVD, allow her feet and fingertips to soak for about 10 minutes. Then remove one hand from the emesis basin while the fingers of the other hand continue to soak in the warm water. Clean gently under the fingernails with a plastic applicator stick. Next, with a soft cuticle brush or nail brush, clean around the cuticle of each finger to control overgrowth. Thoroughly dry the hand with a towel. Repeat this process with the other hand. The next step is to trim the nails. Cut straight across at the level of the finger. You can also follow the curve of the finger, but be sure you don't cut down into the nail grooves or folds. When you are finished, use a disposable emery board to round out any sharp corners. When working on the patient's feet, begin by cleaning between the toes and scrubbing calloused areas with a moistened washcloth. Then thoroughly dry each foot. To trim the toenails, you're going to cut straight across or follow the curve, the same techniques you use to clip the fingernails. Stay at the level of the toe and watch out for the nail grooves or folds. With a disposable emery board, round out any sharp corners. Finish by rubbing lotion thoroughly into the patient's feet and hands. Then dispose of your used supplies. Clean the patient's nail clippers with soap and water. If they're soiled with blood or body fluids, clean them according to agency policy. Return equipment to its proper place and clean the bedside table. Remove your gloves and perform hand hygiene. Document nail and foot care. If there are no specific areas indicated, make a note in the medical record. Note how the patient tolerated the procedure and whether there were any complications.